In this video lecture, I wish to review briefly the subject of depression and some of the most commonly used classes of antidepressant medications. So we'll look at our handout. All right, so the subject is depression and antidepressants. Now, depression, I want to briefly contrast that with anxiety, because anxiety and depression are two of the most common emotional states that all of us experience at different points in our lives. So anxiety is primarily an emotion related to worry and fear about the future. So it's anticipating apprehension about what might happen in the future. And this includes fear for health and safety. Right now, we're experiencing the coronavirus, COVID-19. People, some are experiencing apprehension about that anxiety. Anxiety about being late to take an exam or make an appointment or to catch a plane. Fear of the dark, fear of being alone. These are all worrying about what might happen in the future. And the symptoms include, and I've listed them, frequent urination, a lump in the throat, but rapid heart rate and so on. Now, the most common medications that are used to manage anxiety are the benzodiazepine drugs such as Xanax. And I have another video pertaining to the anti-anxiety or anxiolytic drugs of this class. But our main focus is depression. And depression is another very common emotional state that we all experience from time to time. And it's related to the past rather than the future. It's related to a loss, experiencing or suffering a loss that's already happened and now having to adjust to live in the where we've experienced that loss. So this includes sadness, an empty feeling, despair, tearfulness, negative thoughts. Many people experience fatigue and want to sleep a lot. They may be short-tempered. They may actually, in terms of appetite, they might actually eat more and gain weight, or they might lose their appetite and not eat at all. And in the more severe forms of depression, there may be thoughts of death or even suicide. Now, the frequency of depression in the population is that about 8% of the adult US population is diagnosed with a clinical condition called major depression. So we're going to talk about different categories of depression in just a moment. So major depression is where somebody definitely is depressed chronically and may require medication. This is more common in women than men. 70% of women have major depression, 30% of males. Sometimes we're not sure if that's because women are more inclined to go to a doctor when they're depressed than males, but my own personal opinion is that women emotionally are more prone to depression for genetic and hormonal reasons than males. Depression also becomes more common in the elderly, and again, part of that may be anticipation of one's mortality, confronting mortality, which can be depressing. Now, there are genetic factors that can affect one's tendency to become depressed. It's been suggested that as much as 40% of the individuals with major depression may be accounted for by genetic factors. And there has been research on this. More research is continuing. There exist what are known as vulnerability genes and resiliency genes. Vulnerability genes are related to where somebody genetically, after experiencing a loss, gets emotionally devastated more so than others. And resiliency genes are related to where other people, after they experience a loss, they are depressed, but they bounce back more rapidly. They return back to their previous lifestyle more readily. And again, these may be genetic factors. There is a neurotransmitters. This is called the neurotransmitter theory. There are a number of different neurotransmitters in our brain, and it's believed that imbalances in these neurotransmitter levels may lead to different types of emotional and behavioral states, including depression. The three major neurotransmitters that you should have some appreciation for are serotonin, dopamine, and norepinephrine. Serotonin levels seems to affect mood, anxiety, and even obsessive compulsive disorders. Some medications are designed to elevate or raise the serotonin levels. Dopamine levels seem to affect motivation and pleasure. Elevated dopamine levels increase motivation and pleasure. Norepinephrine neurotransmitter levels affect one's levels of alertness and energy levels. Now, there are environmental factors, and we mentioned that depression is related to a loss. So these are things that happen in one's life. These can include divorce, loss of a job, a loss of health, where somebody is diagnosed with cancer or has just had a heart attack, or diagnosed with Parkinson's disease or Alzheimer's disease. These can be devastating when one is diagnosed with these, and commonly results in depression. Now, another environmental factor that can lead to depression is gloomy weather. And in fact, there's a category of depression called SAD, seasonal affective disorder, we'll get to in a moment, that is related to too much exposure to gloomy weather. Also, certain medications predispose an individual to becoming depressed. We've listed a number of medications here. But the specific medication that I highlighted that I do want you to know are corticosteroids like prednisone. So individuals who take corticosteroids for an extended period of time, it can affect them emotionally and could include causing or contributing to depression. We've listed on the top of page 3 other drugs that can also lead to depression. And I'll just mention progesterone, which is found in birth control pills, oral contraceptives, can lead to emotional effects, including depression. Now, as we mentioned earlier, there are different types of depression. The most common depression that we all experience in our lives is technically called an adjustment disorder with depressed mood. And it really means exactly what it says. This is sadness in response to a real personal loss, and the person has to adjust. It'll take a while for them to heal from the divorce, a loss of job, a medical diagnosis, financial problems, and so on. And they will be depressed. But the good news is most people heal after a number of months from this and come out of it adjusted, having made the adjustment. Chronic depression is clinically called as major depressive disorder or clinical depression. This is severe depression that does require usually medication. And as we mentioned on the previous page, about 8% of the US population is on medication for clinical depression. A third type, letter C, a third type of depression is called postpartum depression. About 12% of women after childbirth experience fairly severe depression. And again, that's usually, they heal from that. It's probably related to changes in hormone levels. There may be genetic factors that predispose women to postpartum depression. We had mentioned previously that gloomy weather can lead to depression. This is known as seasonal affective disorder, or SAD, of which about 5% of the US population experiences this. This is common in, for example, cities like Seattle, Washington, where 300 days of the year it is gloomy, overcast, and cloudy and rainy, and that can be depressing. Incidentally, the treatment for that, at least in part, is to get more sunlight, even artificial light with a spectrum that is more like the sun, or going to a tanning booth and just getting more UV rays of light. There's a fifth, letter E, a fifth type of depression that I'm not going to talk about, dysthymia, so we won't worry about that. Now, as far as treatment for depression, before we get to the classes of drugs, what are the non-pharmacologic approaches to a depression? So these include, number one, most importantly, physical activity or exercise. There are a number of theories as to why physical exercise it has an antidepressant effect, makes us feel better even when we're not in a depressed state. These include the release of endorphin neurotransmitters, the so-called runner's high. During exercise, our body temperature rises, and that's why even a hot shower may be beneficial, a bath. A letter C, a third reason why exercise may be beneficial is increased circulation throughout the body, including the brain. A reduction, letter D, in inflammation. And basically exercise increases our resilience to physical and emotional stress. Another factor that can be beneficial for when one's depressed is eating healthy and reducing one's sugar intake. And a third approach, of course, is psychotherapy or counseling. Okay, now as far as using antidepressant drugs on page 4, we should point out that as many as 50% of the population who take antidepressants, they may not work. So 30 to 50% of individuals who take antidepressants may not show any response. Obviously, sometimes they will try more than one antidepressant. But in fact, if one has to try a second antidepressant, it may work, but there's even a higher probability that using even another antidepressant will show no improvement in its effectiveness for real clinical depression. Common side effects of antidepressant drugs include xerostomia or dry mouth and weight gain. We've listed a couple of others, but we're going to emphasize those that are highlighted here. Now, the general approach that's used in the use of antidepressant medications is to start low and go slow. In other words, they start with a low dose. Most antidepressants require a couple of weeks before you start to see an effect, if you even do see an effect. And if they don't see an effect after a couple of weeks, before they switch to another alternative antidepressant, they will raise the dose. They start out low, and then they will gradually titrate to a higher dose. And only after trying a higher dose over a number of weeks or months will they possibly decide to try a different antidepressant medication or regimen. So start low and go slow. Slowly raise the dose and be slow to change the medication that the patient is taking. The indications that the antidepressants aren't working might include aggressive behavior and anger. This is a side effect of the antidepressant, and it's not having the desired effect. In fact, quite the contrary. We won't emphasize all these indications that the antidepressants are not working. Now, there are a number of classes of antidepressant drugs. The single most important and most widely used class of antidepressants are the selective serotonin reuptake inhibitors. And then we're going to mention those. Then we're going to talk about the SNRIs, the NDRIs, the atypical antidepressants, the tricyclic antidepressants, and the MAO inhibitors. Let's get to the right page here. Okay, so we said that the most important class of antidepressants are the SSRIs, the selective serotonin reuptake inhibitors. Our prototypical example is fluoxetine. It ends in -ine. There are a number of others in this class that also end in -ine or pram. We'll see that in a moment. It goes under the brand name Prozac. It's ranked number 31 among the most prescribed drugs in the United States. Now, what these drugs do is they, normally a neuron releases a neurotransmitter, in this case, serotonin, and commonly the neurotransmitter is then retaken up back into the synaptic knob of the neuron. These drugs interfere with the reuptake of the serotonin, enhancing, increasing the amount of serotonin in the brain and enhancing the action of serotonin, which is a mood elevator. So that's what we wrote here, is that it inhibits synaptic reuptake of the serotonin, increasing serotonin levels in the brain, and generally, hopefully, elevating the person's mood. These SSRIs are used to treat depression. They are the first drugs that are tried. They are used for many other purposes, including phobias. Phobias are the most common of the psychoneurotic disorders, which sounds weird, that term, but these are the common fears that we have, ranging from fear of spiders, fear of snakes, fear of getting on a plane, a fear of of heights, of being in high places, all kinds of common fears that all of us have. Also, they're used to treat social anxiety of people who get anxious and depressed and have other symptoms when they are in public places. Panic disorders, PTSD, post-traumatic stress disorders, they are used for, and for OCD, obsessive compulsive disorders. Again, I have another video lecture covering the use of these drugs for these psychoneurotic disorders that you should watch. The adverse effects are few. That's why they are so commonly used, because they have the fewest side effects. One of the side effects can include agitation and insomnia, and they do cause xerostomia. You should know these couple that I've highlighted, but we won't test you on the other side effects of the SSRIs. There are many other SSRIs besides Prozac or fluoxetine. They include Celexa, which is ranked number 26 most prescribed drug in the United States, and Lexapro, ranked number 20 among the most prescribed drugs in the United States. Notice that the generic names of these end in pram. I'm not testing you on that, but I'm just pointing that out. The others, like fluoxetine or Prozac, have the "ine" ending, and this includes sertraline, which goes into the brand name Zoloft, ranked number 14 among the most prescribed drugs in the United States. So very, very commonly used. Okay, a second class of drugs used as antidepressants are the SNRIs, and that stands for serotonin norepinephrine reuptake inhibitors. Remember, we mentioned those three neurotransmitters: serotonin, norepinephrine, and dopamine. And we actually have drugs that can raise these different neurotransmitters, including all three of them. So an example of this is Cymbalta. It's ranked number 46 among the most prescribed drugs in the United States. It works by inhibiting the reuptake of both serotonin and norepinephrine, raising the levels of serotonin and norepinephrine in the brain. And in so doing, it elevates the mood by raising serotonin levels and increases energy levels by raising norepinephrine levels. Commonly, these SNRIs are used for people who have depression related to chronic pain. Examples of that include the use of Cymbalta to treat chronic pain syndromes, including fibromyalgia. There are other SNRIs, including venlafaxine, which goes under the brand name Effexor, which has been prescribed for postmenopausal depression and symptoms of postmenopause. So, okay, those are the SNRIs. A third class of antidepressants are the NDRIs. This stands for norepinephrine dopamine reuptake inhibitors. The classic example of this is bupropion, which goes under the brand name Wellbutrin. It is ranked number 23 among the most prescribed drugs in the United States. It inhibits the reuptake of both norepinephrine and dopamine. Notice it's not affecting serotonin, but by raising the norepinephrine levels, it increases energy levels, and by raising dopamine levels, it increases pleasure. It is used as an antidepressant. It has an advantage that, unlike almost all the other antidepressants, it does not cause xerostomia or dry mouth. It has also been taken by individuals to control smoking and a craving for nicotine and smoking. Another class of antidepressant drugs are called the atypical antidepressants. This includes Desiril. Desiril was ranked number 30 among the most prescribed drugs in the United States. It specifically raises serotonin levels, just like the selective serotonin reuptake inhibitors. The mechanism is a little bit different than the SSRIs. It's called technically a serotonin modulator. You don't have to know that. But again, by raising the serotonin levels, just like Prozac, it elevates the mood. And it is a pretty commonly prescribed antidepressant medication. Also notice it does not have the atropine-like side effects, so that means it does not cause xerostomia. There are some other of these atypical antidepressants, but Desiril is the most common. Now, incidentally, I'm not asking you to memorize the names of all these drugs. Just be aware of some of these different categories or classes of drugs that are used as antidepressants. The next class that's used for severe clinical depression, chronic depression, are the tricyclic antidepressants. They basically raise all of the neurotransmitter levels, including serotonin, norepinephrine, and dopamine, elevating mood, energy, and pleasure levels. They are used to treat major depression, major depressive disorders, clinical depression, for people who are chronically depressed, when the other drugs that we've previously mentioned are not effective. This is not the drug usually chosen first, but it's a drug that will be chosen second if the others are ineffective. It has been used, in addition to treating depression, it's been used to treat chronic orofacial pain, including TMJ, temporomandibular joint pain. It's been used to treat bipolar disorder and other problems as well. But we'll just call it a drug used primarily to treat clinical depression. It's also been used to treat enuresis or bedwetting, and even to treat chronic itching. Something that I commonly point out when I give these lectures is that if you have a patient and the patient indicates that they're on, let's say, one of these tricyclic antidepressants, you don't know for certain exactly that they're taking it for depression, because they might have been prescribed it for chronic itching or for TMJ pain. So because these drugs in each of these different classes is used for treating or managing more than one type of clinical disorder, you don't necessarily know exactly the reason why they have been prescribed that drug unless one asks. The tricyclic antidepressants do cause weight gain like some of the other antidepressants, and they do cause xerostomia, which is called an atropine-like side effect. Most drugs, including the antidepressants, most of them do cause dry mouth. There were a couple of exceptions. There's some other adverse effects that is caused by tricyclic antidepressants, but I'm not going to test you on them. There are many other tricyclic antidepressants. We're not asking you to know the names. And again, they have other off-label uses, again, for the treatment of chronic pain and TMJ. They're used in the management of migraine headaches and for other purposes as well. Here we've got some other tricyclic antidepressants listed. The last class of drugs that are used as antidepressants that we'll mention are the MAO inhibitors, the monoamine oxidase inhibitors. Now, monoamine oxidase, MAO, is the enzyme that breaks down catecholamines like norepinephrine and dopamine. And so these drugs inhibit the enzyme that breaks down these neurotransmitters. And so if you inhibit the enzyme, then the result is increased levels of these catecholamine neurotransmitters, these biogenic amines in the brain. So the effect of MAO inhibitors is that it raises serotonin, norepinephrine, and dopamine levels and increases, elevates the mood and energy level and so on. Now, again, the difference between one class and another class that may both raise the same neurotransmitter levels is the exact mechanism of action. And sometimes they just find that a drug that works through a different mechanism of action is more effective than another drug that raises the same neurotransmitter levels but works through a different mechanism as far as how it works. Notice again the MAO inhibitors cause xerostomia or dry mouth. All right, and then this is page 10, the last page. And again, we've just mentioned some cautions and contraindications. We're not going to test you on that. And we've listed some additional other MAO monoamine oxidase inhibitors. All right, so that completes our brief review of what depression is, different types of depression, and the several different classes of drugs that are used as antidepressants, as well as being used for managing other clinical problems as well.